rationale for the use of CGRP monoclonal antibodies in the preventive treatment of migraine is the findings that Lars Edvinsson and myself made perhaps 20 years ago, where we showed elevated levels of CGRP in patients during migraine, and we showed reversal of that with the treatment with the triptan. Subsequent studies have shown that CGRP mechanisms acutely work and preventatively work. There's a very deep biological rationale for doing this. The findings today have been phase 2 studies, and there are two groups. There are 4 antibodies in phase 2 in episodic migraine, all have been positive. And there are 2 antibodies that have announced phase 2 data in chronic migraine, and they've all been positive. So what we're looking at is at least 6 randomized placebo-controlled trials that have all worked. At the moment, the contraindications to the use of these antibodies would be reactions to them, and would be any mechanism in the body that involves CGRP in an important way. Now, I'm saying that in a roundabout way because at the moment we've got theoretical limitations but no absolute contraindications. The use of monoclonal antibodies in migraine implies long-term use for prevention. And what we're seeing is the phase 3 studies and the open label studies from control studies that patients are coming into that have been going on now for some time, more than a year. And we actually haven't seen any problems arise. So it's pretty good news. It's good news for patients and it's good news for doctors. The future of migraine treatment is incredibly bright. We have a major, biologically well understood, targeted therapy for the first time as a preventive in the CGRP monoclonal antibodies. And we have other things that are coming. We have the so-called dietans, the 5-HT1F agonists. We have other peptides that we're looking at. And we have the whole range of neuromodulation options like transcranial magnetic stimulation or the non-invasive vagal nerve stimulation. It's bright. It's really bright for patients who've got disabling migraine because we'll do better for them, and it's great for doctors to be involved in something that makes people better.